Good afternoon, everybody. Thank you for being here. I'll go through the data and then go over again some of the changes and some of the initiatives and then take some questions. We had no new deaths over the last 24 hours. Positive news there. We've lost 218 neighbors to the pandemic since March. Obviously keeping everybody in our thoughts and prayers there. 5,017 tests back yesterday. Our 7-day rolling average is 2.85%, going up, stabilized to a degree over the last few days, but the Halloween activity is driving cases at a higher level. Last week we were at the 100 cases level. This week we're closer to the 200 level. So we see that happening over the next few days as well. When we look at hospitalizations, we have 57 individuals in the hospital. That's an increase from yesterday. Each day, remember, the hospitalizations are a direct correlation with active cases. Each day we're seeing more people get admitted into the hospital, but also released from the hospital. So some days it goes in the right direction, others it's in the wrong direction. Out of the hospitalizations, we have 7 in the ICU, so it's up 1 from yesterday. So please keep these 7 individuals in your thoughts and prayers. In the hospital, 35 Caucasian, 3 African American, 2 Asian, 2 of another race, and 15 individuals. We just don't have their demographic information out at this point. Overall, we now have 6,775 positive cases since March 16th. That's 178 new cases since yesterday. Out of the 178, 59 are related to higher education, and 13 are related to K through 12, 6 being students, 7 being staff. Important to note, out of the K through 12, we report K through 12 cases, whether someone is in the building while they're sick or not, or if they're a remote learner or not. All depends. Out of these 13 positives, there was not a single quarantine from a classroom related to that, because these folks just weren't in the building. Other details out of the 178, 6 travel, 22 household contacts, 5 senior facilities, 80 community spread, of which 42 are a known source, and we have 53 cases that we're still investigating. Right now, essentially, we're probably going to, for the next week or two, define the cases in 3 categories: travel, local, or senior facility. Because right now, the reality is if you are out and about with people, there's a higher level of risk, because gaps in the investigation at this point, we're finding out about gaps in the investigation 24, 36, 48 hours down the road. So now it's just safe to assume that when you're out, you should be wearing a mask, you should be distancing, and certainly avoiding large gatherings. But we're probably going to report, as long as we're going through the Halloween surge, in 3 categories until we get through this surge. Looking at total cases, 3,715 female and 3,059 males. 900 have been under 19, 1,630 in their 20s, 925 in their 30s, 800 in their 40s, 948 in their 50s, 667 in their 60s, 399 in their 70s, 325 in their 80s, 181 in their 90s. So we're going to go through the various testing right now in the areas where people have to pre-register for testing. We've expanded testing capacity. We've opened it up to asymptomatic. We're doing targeted rapid asymptomatic testing, but we need to have you registered. We can't just have people. Right now there's so much demand, at the F shed that we can't just have people showing up, because that just slows down the whole process. We'll continue to expand testing as we have to for various parts of being in a yellow zone, but we do need people to pre-register in advance. So F shed, what kind of testing is going on at the F shed? We have 2 labs. Upstate does a saliva swab. To register for the saliva swab, we give this for our K through 12 first, then our education partners, 315-464-2582, or you can go on to mychart.upstate.edu and pre-register. That's very popular, so sometimes it takes a little bit longer. Also at the F shed, we have symptomatic or asymptomatic testing for anybody. You go on to ongov.net/Cayuga Medical and register there. Testing at this F shed right now is Monday through Friday from 9 to 1. Next week we may be expanding hours on that. We've been doing asymptomatic rapid nasal testing here at the On-Center for the hospitality industry. Today we had another day. We're expanding that. This week we're focusing in on hospitality, and then certainly we're probably going to open that up to different industries next week. And we're as we learn how to do this and do it better and keep the flow going, we'll continue to expand the number of tests we'll do per day. But again, check our website for available slots if you're in the hospitality industry at covid19.ongov.net. We do anticipate more slots opening up as we get more comfortable. Looking at yellow zone school testing, today we actually started this. Our first school, Word of Life Academy in Baldwinsville, small school. I believe it's going well. But again, this is a good one for us to do our test run through, as next week we'll be busy. We're going to emphasize on elementary schools first, then we go to middle, then we go to high school. So why do we do that? We do that because it avoids disruption to child care, continuity of care, and certainly our nutrition as well. Right now we have over 50 schools that we've been told have agreed to test to stay in person. We've created 5 testing teams who will visit each school once a week to complete the testing requirement. This is in addition to expanding capacity here at the On-Center. So this will probably be between 3,000 and 5,000 tests a week in these buildings. We'll be using our Binax Now rapid kits in the school buildings. So these are not, most parents have been alerted to this, but these are not the large swab like this. It's more of a swab like this, where it's more the inner lining of your nostril, and then it becomes a rapid test after that. So certainly a better experience for the child than a traditional test. But we will be using these, and we'll be going full-blown at it on Monday. Other yellow zone restrictions. We'll go over these again. The restaurant seating, if you're in a yellow zone, maximum number per table, 4. Gatherings, 25 people. These are gatherings for outdoor gatherings, businesses, and obviously the 20% testing. We heard from the governor yesterday related to some statewide policies. He put it forward related to essentially a curfew on hospitality, bars and restaurants at 10 p.m. In addition to that, gyms now at 10 p.m. got to close. So that's a statewide policy that's been outside of this yellow zone situation. Again, I understand it's disruptive and it's very disappointing. I'm very disappointed as well. My family is coming in, my immediate family. I won't be able to be at my mom and dad's house now because my sister will take precedence because she's coming in. So I have a beef with my sister on this, but this is what we got to do. We are where we are now. This is what we got to do, and certainly it's disappointing, but there's no question gatherings have driven cases. When we're looking at this situation right now, we're at a point where we're hearing from folks, and folks are anxious and they're nervous about what happens in an orange or a red. Is my industry going to be shut down again? The answer is that's up to us collectively. These aren't rules that I think any elected leader likes to put into place. I know some people disagree with that, but I know I can speak for myself. Quite frankly, I'm a little ticked off that we're in this situation because we worked so hard to get in a position where everybody was getting their liberties back. We were getting businesses open, with the exception of a few, and we were advocating on a daily basis for those businesses. So now the virus is clever. We're a little complacent. We had so much success early. Now we need to get re-engaged. So for us to avoid further restrictions on our economy, on our day-to-day living, we need to rally together. I know we can do it because we did it before. And now we know more about the virus, and now we have an end game in sight. We have a vaccine in sight. So it's really up to us to modify our own networks. Doesn't mean you stop being friends with somebody. It just means you maybe just see lesser people, or your children, when they're interacting with people, maybe they just interact with one or two friends, and you talk to those families and you recognize that they're taking this pandemic seriously. These are things that we just all have to do, because we were doing it before. We were doing it in the beginning of the pandemic, and the difference then being we didn't have our economy open, right? So that anxiety level of not being able to go to work or go to the gym or get a haircut, that's not the case now. But we do need to really watch who we're gathering with and the numbers, and make sure that these families are taking this seriously. And that's how we protect our own families. And if we can do this as a community, if we can get tested, asymptomatic testing's there, get tested. In addition to that, if you're sick, there's no excuses. You need to get tested and rule out COVID. If we do these things and watch our interactions and really take everything seriously, we'll get through this. And in 2 and 3 weeks, we'll see the data going the right direction, and we'll go into winter in a strong position. And I know we will. I have full faith that we've gotten our wake-up call. Questions?
Of a place where people can go if they see a business, doing something they're not supposed to be doing. With these gatherings now, if, say, a neighbor sees a party going on next door, is there going to be a tab to, tell on your neighbor about gatherings if they see more than 10 people?
Well, I can tell you from experience from the beginning of the pandemic, the tattling will go on, and we expect it to happen. We've been very good at enforcing the commercial rules. I don't have a police force. I'm not sending over someone who's not trained to deal with gatherings to break that up. The local police departments will be responsible for that, whether it's the sheriff's jurisdiction, a village police department, a town, a city of Syracuse. But certainly, if we hear of gatherings in advance that are breaking the rules, how big Halloween parties. We heard about some of these. We heard about some big weddings that the management was saying, "You don't worry about it. I'll let you dance. We'll let you not wear masks." All these things. We heard about those. We investigated those. Sometimes the people are correct that give us the lead. Sometimes they're not. But if the question is more geared towards, is the county COVID task force that has been doing enforcement at businesses going to be out knocking on doors at people's homes on Thanksgiving? The answer is no. Our people aren't equipped to do that. That we're not going to put our people in potentially a situation where it's harm's way. The local police departments have to enforce the social gatherings like that.
So people should call the police if they see more than 10 people. and
If
they're
that's
concerned.
what people are going to do, that's what they're going to do. We're not going to have a health inspector trying to go to someone's house and break up 12 people on Thanksgiving. That's not that role. Local law enforcement has to do that. So again, that's going to be something that the sheriff's going to have to work through their policy, the city police department in their jurisdiction, and some of these other police departments are going to have to figure out what's practical and what's feasible related to that. This is uncharted territory.
To pick up on that, though, it's not necessarily uncharted if you compare to March, April, and May when you increased the system at the 911 center for these kinds of calls. I mean, you've done many Zooms with superintendents. Could you do conversations with these police departments to get on the same page?
Andrew, right now we're worried about getting the kids tested to stay in the yellow zone. Thanksgiving and all these, the 10-person rule is something that's so far off our mind. And again, I don't have a police department, so this is something that the police departments themselves are going to have to work on, and they are talking to the state troopers and SLA. For the businesses who think that they might want to try to test the rules, I wouldn't. I'm on emails with SLA and with the state troopers talking to their partners. There's enforcement actions that are coming out, and I think they were out last night. I know they're out tonight, and they're going to continue to be out. So I wouldn't push this. But when it comes to what is truly unprecedented, nobody was going to people's houses, Andrew. We take calls. If we knew about large parties, we would reach out to the owner in advance. There's well-documented incidents that happened in the community where the police departments were nervous about going to break up. This is unprecedented where we are right now with the latest executive order.
Ryan, is it your understanding that somebody who has a gathering of more than 10 could be fined?
Yes, that's absolutely correct. You could be fined.
What's your advice to the sheriff? Anything?
The sheriff's going to have to look at his resources. They look at, and just like the SPD will, the calls come in at 911, right? You look at priority 1 calls, and certainly if there's a priority 1 call going on, and a neighbor's saying that I think there's 12 people over at Jones is next door instead of 10, common sense is going to prevail. So that's what's going to happen, and they're going to need, the sheriff is going to assess what they can do, recognizing that gatherings have driven cases. I think nobody was surprised that the state came out with a regulation like this. The number, is that surprising? A little bit, but they came to that number some way, so there's probably some rationale behind it.
But hasn't the governor been preaching that local jurisdictions, local governments need to enforce those kinds of rules? And as the regional leader, doesn't that fall to you in some ways to at least get everyone on the same page?
I think everybody is on the same page. Everybody is doing the best they can with rules that they're learning about minutes, if not, after the rest of you are, right? So there was no advance on this date. We're going to do this. Can you get this going on? So my priority is keeping kids in school right now. Once we get through that and that's accomplished, we'll focus more in on some regional action related to gatherings that will be obviously more popular at Thanksgiving. Certainly, I think that when you put a rule in like this, the positive is you automatically are going to get a lot of people complying with it, right? They're not going to want to break the rules. They want to be part of a solution. This obviously we don't have. I know early on in the community, I think the most law enforcement we probably ever had were during some of the times when we saw protests on the streets. And I think we brought in law enforcement units from all over the county, maybe even outside counties, state agencies, federal agencies. I think we had 800 cops. How many units do we have in Onondaga County? This is the honor system, and if there's egregious activities, they'll be investigated, and I'm sure if there's egregious activities, they'll be responded to by law enforcement.
Let's go to your priority then, the school testing. The superintendents I've spoken with in the past few hours are getting in Liverpool's case, an overwhelming interest in this testing. What are you hearing from them today as these surveys come back in?
I think most of them are okay. I think we got through phase one, which is, do we even have enough people that we can test? And so now it's putting the schedule together, which our teams are going to do, and they'll be working on today and tomorrow, and then it will be getting busy next week. And so again, we had the first school today as kind of a trial test run to see how the system works. But yeah, I think the good news on that is that parents and teachers, I heard teachers as well, want to stay in-person learning. And so that is something that if the commitment was there from the districts, we've made our commitment that we will rearrange the deck and what we do and focus in on that being our priority.
Is the deadline Wednesday to get to 20% 1 week after?
No, so it's a Monday to Monday. So we'll have all week to get that done. So again, focusing in on the elementaries first, and then middles, then high schools.
You ran through the whole list of all the testing that's available in the county, but some parents are kind of complaining that they're having a hard time getting tests for their students and their kids. What do you have to say to them? What advice do you have?
Yeah, I'll get the occasional complaint. So if you want to get a test, you can go to your doctor. You can go to St. Joe's. You can go to Krause. You can go to Upstate. You can go to the F-Shed. What else are you looking for from me? You know, I don't. Do we? I think, is there a little bit of a? You know, do people want the now? Yes. Do people want I know some people go to Oswego or Utica to get one of the antigen rapid tests. Sure. We're trying to get equipment that is more reliable than those tests and offer that to the public as well. I can't just call Abbott and say, I want 20,000 rapid test kits. I've tried. They're made here. They're made in Onondaga County. They aren't allowed to give governments contracts like that. So there are options. I think people get frustrated when their child gets sick. They want to rule out COVID right then and now because they want them to go to school. And they know they got to get that or a doctor's note, and getting into the doctors is tough. So I'm in the same boat as these parents. I have 3 children as well. But there's testing. Let's not fool ourselves on that. There's plenty of testing, and the testing is getting expanded.
You're a dad. What would you say to students who just naturally are uneasy with a test, maybe in some cases now weekly tests?
I was uneasy with the full nasal swab test. I was able to stay away from trouble and not get sick until there was the saliva test where I got a test, and then I did use the rapid test as well that these students are going to be using. So it's much different, and it's not something that they should be scared of, and it will be very quick. And the nice thing is you'll know whether you're negative or positive very quickly as well.
Keeping on the topic of parents, we've heard some examples of, we heard about a parent bringing a sick kid to the dentist because they're afraid the dentist is going to shut down and they need to get their kid in, and then another one was near a friend who had COVID and they brought him to soccer practice anyways. Yeah. What do you have to say?
Yeah, I mean, these are just unforced errors, and so we can't have, when people are sick, we got to rule out COVID. Let's not freak out about things shutting down, okay? The things aren't, that's not where we are right now. There's been really data-driven restrictions put on certain industries that have driven cases. And it's not that the businesses are doing the wrong thing for the most part. It's that those are industries where people come together more. So when you have the virus more prevalent in the community and you go to places where there's more people, you're going to have more cases. So now the virus has worked its way up. It's here. We have to do a better job of starving it again and distancing again. So that's why the restrictions have happened. And so these are just restrictions. Does it hurt for some of these businesses? Yes, it does. And the best way for all of us to react is to make this very temporary and to take it seriously again. Over the next 2 weeks, let's just kind of become a little bit more homebodies, get your takeout. If you're going to see other people, okay, are they taking this thing seriously? What are they doing? during the week. And certainly I know with my own children, could you hang out with one friend maybe? Sure. But what is their family taking this seriously? If we all do this for 2 weeks and just get through this, we'll get the data down. We've done it before, and we'll do it.
With the numbers, how they are, do you expect to see the yellow zone expand next week?
I don't think so, because I think right now, for the first time, you can point to higher ed as being something more than a blip on our radar of cases. That's in one area of the yellow zone, right? And so I think the higher ed cases are going to go away in probably the next week. Syracuse University is testing kids out. Some kids are leaving for the semester. We'll get cases until the kids are gone. And then it's a question, we're going to get our kids back in from other colleges, so it's a question of are kids going to behave? I think they will. And so I think some of these, we've had 50-plus higher ed cases 2 days in a row. Every indication is tomorrow we'll have the same, but that's going to tally off. So then where are we after? So we'll be down more, which will seem like a victory, but the number will be at 100, 120. That's still too many. So we're the ones that will get that number down.
Have you decided with the emergency management team what the testing at schools will look like? I talked to Mark Potter yesterday whether, he said he'd be happy if it was in the nurse's office, but he'd be happy if it was in the parking lot. Have you figured that out yet?
Obviously, if it was summertime, we could do it outdoors. We're probably going to need more space, something similar to a gymnasium, to really set it up the right way. You need a place where people can sit in a distance way. Actually, we might not even be doing that. That's how we do it here. The kids probably are going back to their classroom. But you need a little bit more than just a nurse's office. You're going to have too many people within that confined space. So I'm sure we'll be using the gymnasiums in most of these facilities.
Ryan, could you explain a little bit more about how you're going to be reporting the numbers going forward? It sounds like you're going to consolidate it because there are so many unknowns now that...
Our priority's got to be getting to the immediate contacts for quarantines, and right now for them to tell me, and again I like to know this data more than anybody else, for them to tell me the type of case and where it's coming from right now in real time is not possible, and so we're more concerned about them getting the people who've been exposed in the quarantine so we can box it in than the rest of the investigation, and we can get back to trying to put the puzzle together later on. So essentially the three categories that we need are essentially local, which will be basically your community spread in your households, travel, which will be travel, and we'll still break that out, and then I want to know the senior cases because those are our most vulnerable members of the community.
Have they been encountering delays in getting to contacts? Is that taking longer than it should now?
It's you're going to when you have this level of cases, it gets more challenging no matter how many people you keep throwing at it. So that's something that we asked Dr. Gupta, how can you, what can we do to help make your life easier? And she said, this part, even though it doesn't sound like a lot, this part of the process takes a lot of time. And so I think it's safe to say, too, that the virus is in the community. If we, knowing whether or not somebody went to Lowe's with the virus at this point, we can assume somebody went to Lowe's or Home Depot or Wegmans with the virus at this point. It's in the community. So what do we do to protect ourselves? We wear a mask, we distance, you wash your hands, you don't put your hands on your face. Everything that got us to where we got our economy went from lockdown to restart, reopen, and had a great summer. We had a great summer, great fall. We can get there again, and the vaccine's right around the corner.
So probably those notices of potential exposures will probably...
Right now, I can say for the immediate future, that's not our focus right now because of how much work it takes for us to do that, and that the community should be under the assumption that the virus is in the community, and that if we do the things we know work, we're going to be okay.
Are there, we've heard examples of parents of students this case a preschool who was exposed to a confirmed case close enough that the school said, don't come in right now. We have to wait for the county to do its work. But they haven't heard from the county yet. Even the person positive, according to the school, hasn't heard from the county yet. Is there a chance people are positive but waiting a few days before the contact tracers get to them?
No, it won't be a few days. I mean, how these things work, if you go for example, if you go to a doctor's office and you get a test, it comes back, they don't call us and say, go call Andrew. They call you, and then they send in, either fax in the result to our health department, or it goes into the state eclair system. We get the results from the state eclair system and or the fax from the provider. And then we have to match to make sure the ones we're getting in, that there's not duplicates. Often there is. But that will, I'm sure, with even the eclair system at this point, when you see surges across the state of New York, that they may even be hours behind now too. So, but that's how we find out. Typically, there may be incidents where you know before us, and depending on the timing, when you find out, there might not be anybody at the office getting those in except for 8 hours later, depending on when it is. So the reality is, if somebody tells you you're COVID positive, you're in isolation. We know that. And certainly, if you're COVID positive and you live with 4 people, they're in quarantine. This is common sense. So, you know, you get a head start like that. And normally, what you may have happen is somebody finds out they're COVID positive. They call their employer right away because they can't go to work the next day and say that. So they may find out that way. But days, I haven't heard that at all.
But what about a parent whose student was in the same room, so the school says, don't come right now? Are they quarantined? Should they quarantine? What advice do you have for parents waiting?
So let's put this in McMahon household. So Maddie's at school. She's potentially a contact to a positive. Should Ryan be in a quarantine? The answer is no. A contact of a contact is not in a quarantine.
Should Maddie?
Should Maddie should be in a quarantine until otherwise, yes.
Have you fined people for breaking quarantine, or figured out if you can retroactively fine them if they traveled and
Yeah,
quarantine?
we can retroactively do that without question if we have evidence. Again, there's an appeals process, and at some point, some of these things will make their way to the legal system when this is all said and done, and people will, the courts will decide what's legal and what's not. Because we find people that haven't paid, we just don't have time to totally chase them down right now, unless it's a frequent flyer, which it looks like we might be getting some of those these days. But certainly, we may have, I'll have to look into it. We did have evidence at one point on a couple of individuals that broke quarantine very provocatively. They put things on social media, and so we may have looked into that, and we'll have to see where that was. I know our lawyers were looking at that. But again, with these things, you got to have, if you're going to find people, you got to have pretty strong evidence for it to hold up in court.
Can I ask your opinion on closing gyms at 10 p.m.? Is that going to accomplish anything?
Not in our community at this point. We haven't had situations where gyms have driven spread. I think because our business owners got their businesses open later in this process, the COVID fatigue on enforcement hasn't happened there. And I think many of the folks that work out really want to get a workout in, and so they're going to follow the rules. But yeah, that is not a regulation that we think is going to move the needle at this point in our community.
Something that you were worried about in the spring, that was a big issue, was the PPE stockpile and getting your hands on that. I know that over the summer you kind of bolstered that, made sure you had enough. Where does that stand right now?
Yeah, we're good right now reevaluating that. I think one of the things that does concern everybody, I think, a little bit is the elevated activity across the country and the globe again. So that's something that we're evaluating, and the big things, test kits, these things, these natures aren't a challenge now. Right now, I think eventually, if this thing was going to be prolonged, you might run into problems there again. But it looks like the vaccine is on way for an approval later this month, which is good. But again, you can never, we're watching that hospitalization rate very closely, and looking at our supplies and understanding that we'll probably be asked at some point, if hospitals or nursing homes run low, that they'll need help again. So we're watching it closely.
And you opened asymptomatic testing to hospitality industry and just general community members at different places. How many cases have come from that?
We've had one from the asymptomatic rapids for the hospitality. It's tougher for us to tell at the FSHAD because you have symptomatic and asymptomatic going. So I'm not sure if we've had any at the FSHAD, but certainly we know the Bionex kits work both ways. We've been getting lots of negatives, but we got a positive. So that was something that proof of concept. That's the case we're looking for, is the one person that you'd be interacting with when you go to a restaurant that may be carrying it, may be spreading it.
Is the Syracuse Community Health Center still an option?
Correct. Yeah, they're still testing. Yeah, absolutely. I missed that earlier. I apologize for that. Syracuse Community Health Center is still up and running as well. I'm not sure their hours. I don't know if what their weekend hours are, but I know they're open during the week.
Is that still county funded and supplied?
We do not. Right now, the only testing site that we have levels of control over are the On Center and the FSHAD.
What did you talk about on your state call today?
Yeah, I think right now we're in this position on the state calls where clarifying some of the questions that come up around the yellow zone as we move into this next week of meeting the requirements for that. And certainly, obviously, talking about resources is a thing. Obviously, we know we're being asked to do more. Nobody's sending a check for the personnel, right? But the test kits are something that is being talked about, and the state's been pushing forward the Bionex kits that they receive from the federal government, which is very appreciated, so that we can do what we're doing and not have to move labs, right? If we didn't have these Bionex kits and our teams creating these teams, we would have to, instead of do an FSHAD, we would have to somehow take labs and bring labs to these spots. It would be a mess. So these Bionex kits have really worked out pretty well.
You've taken some county resources to help out with the school testing. What's that going to affect on the county at the county's level?
Yeah, we had a call with all of our department heads and talked to them, and want to ask for their cooperation and thank them in advance for not just giving up personnel, but for what it means to everybody else. So we still have mandates in each of our departments to meet, and it's for some departments it might be a little bit slower than others right now, but it's tough. I mean, these going through, these folks got 500 less people in their ranks than they had 12 months ago, and now they're having to do more with less. And they're great professionals. I mean, we have a great workforce and a great team, and our mindset is that how do we get to yes? How can we do something? Not how it's too hard. It's easy to have that mindset, but we'll get through this. We'll meet the challenge, which is a pretty big one next week. But I'm very proud of our team. Our team's done a great job with, and think about it, we were told, we're learning still as everybody else is. We probably find out about some of this stuff maybe 5-10 minutes before you do. And so we've gotten to a zone. We had some input on what that looked like, clarifying the rules of the zone, and then implementing ways to keep schools open, and all this being done in hours. And so really impressed with our team.
As for the rules of the zone, does the yellow zone stay for a week or 2 weeks and then you reevaluate it?
Yeah.
Or is there a chance that next week the numbers are crazy so it's orange? Like where?
No, I think each time you really need 2 weeks to evaluate everything in the pandemic, and because that's how long it takes to drive cases. So if you look at recent history before 2 weeks ago, our numbers were, I think, 1.5 to 2.5 probably percentage, saying, hey, got to get ready, got to be careful with Halloween coming up. Halloween happened. Even after Halloween, I don't think our cases were crazy. We're saying we're uncomfortable with our activity. It's going up, but we didn't know what we didn't know till 10 to 14 days after Halloween. So now, whether this is a Halloween surge, I think it's the beginning of a second wave as well. For us to know if the yellow zone regulations have any impact, we need 2 weeks worth of time to do it. And then in 2 weeks, we look at where it is. My guess is that it will have an impact. There's a couple factors that will help drastically, being that colleges are done with their semester, so that those cases come off the top, so that might skew our data to the positive. But that's coming off, and then certainly we know that the hospitality industry has been hit very hard with cases, and so now we're doing testing, asymptomatic testing in that industry. There's regulations on hours that I know people believe are onerous, but there's a renewed focus on enforcement as well, so that business owners are forced to enforce the rules more. So between all of that, hopefully that will create an environment where we also see the cases start to decrease there. And I think with gatherings, people by now understand that there's a lot on the line now for us to modify some of these gatherings to get the virus to a point where it's on the run a little bit again.
Real quick, you mentioned 50 schools ready to be tested. There's about 85 on the list. Does that mean you're waiting to hear from 35?
It means that 50 of them have been confirmed that they're in the program, and the other ones, again, we've made a commitment. It's our number one priority is to try to keep these buildings going. So that's where it is right now.
And then will you just repeat testing another week?
Yeah, I think we'll have a schedule, and then we'll have a calendar, and that's when we'll be there with each team in each district and each building, and then it probably won't be the same people every week. You'll probably have a rotating number for what the qualification is. But yeah, that's what the plan will be. I think Thanksgiving week will be, it's only a 2-day school week, so we talked to the state about that, so I think we probably prorate the number of tests needed for that week.
Ryan, just to clarify on the 10-person limit per household, how does that relate to the limit on gatherings that's 25 in the yellow zone and 50 elsewhere?
So that is it's its own regulation now, right? So like a 10-person indoor private home regulation that the state put forward. I believe the 50 and 25 would be a situation where if your business was going to have some sort of conference or a meeting and you wanted 20 people in a room, that would be allowed. Outside of the yellow zone, you could be allowed to still have your 50-person wedding, and that would be allowed. But in the yellow zone, if you want to have a type of gathering, it's now 25. But in your own private residence, it's 10 is what the state rule is.
And just another weird detail, the 20% testing rule for schools, does it have to be a different 20% each week? Or
It could be the people?
Yeah.
It could be the same people. I think for us it'd be nice if, now some of these schools are very small, so your 100 students and faculty, if you get, say, 30 people agree to do it and you only need 20, some people will be getting tested 2 out of 3 weeks. But others, I'm sure there'll be a way to handle this, and internally with the districts you figure out how that happens. For us, we're going to be tracking the number of tests to meet the mandate. But again, you don't want to. It'd be if you got 200 people that are willing to do it. If you can spread that out, you get a better sample, so it can be more impactful related to the spread in the community.
And then another minutia detail, is it 20% of the students in Building A and 20% of the staff in Building A? Both of those have to be met?
It's the district with in-person in-person instruction plus staff.
Staff is a separate 20% in person?
No.
No.
No, yeah,
Just
so.
the total number of
total
people in
number.
the building, 20%.
Correct. Other questions? Okay. Well, I hope to see you on Monday. Hopefully we aren't seeing you before then. Talk to you then.